All right, guys, I wanted to do a deep dive into some very cool companies that are being founded and grown right here in Vancouver in the health space. And the first entrepreneur that I've welcomed to the stage is Dr. Essam Hamza. And why don't you give us the quick summary of Premier Health Group, the company you're building, what you're up to, and what you guys do.
Sure, thanks again for having me here today. So just a little bit about background about myself. I'm a family doctor for over 20 years. And always believed in kind of technology and the use of technology in healthcare, and saw the kind of the frustration that patients had in accessing healthcare. So right now in medicine, you as a patient, you have to get access to your doctor to get anything done. So the problem with that is there's not a lot of doctors. It's hard to make an appointment. You have to take a day off of work to get there. You get rushed in a 5-minute visit to do something that often you already know you need, like a prescription refill or talk about your lab results and so on. So it's very frustrating for everybody involved, the doctor, the patient, the healthcare system, and so on. So as a doctor and a believer in technology, I tried to do as much as I could in the 4 clinics I had in Lower Mainland, but then Premier Health, a public company, bought the clinics about a year ago. And I came on as a CEO, and we said, let's change this whole dynamic from a doctor-centric model to a patient-centric model.
And how many clinics do you own?
So right now we own the 4 clinics. We bought the health tech company out of Victoria called Cloud Practice. They have about 17 developers and employees there. And they are already in 300 clinics across the country. They have about 3,000 doctors in their system and about 3 million patients. So we went from 100,000 patients that the clinics had to access to about 3 million patient charts in our system in 8 provinces across the country.
Got it. And now the challenges that you described, access to physicians, et cetera, expediency of getting results, is this, how does Canada stack up on a global level? How are we performing as a country?
Horrible.
Horrible?
Yeah, we're bad. I mean, around the world it's bad, but in Canada it's even worse because the way we have our system set up is that we treat the doctors as business owners, let's say. So if I have a clinic, I'm a business owner, but the difference between a regular business owner and a doctor's clinic is that I can't transfer costs over to the patient. So when new technology comes in, like electronic medical records or telemedicine or whatever it is, the doctor has to absorb that cost because I can't charge you anything if it's available under the Healthcare Act. And so it's very frustrating for doctors because they want to do some stuff, but they don't want to incur $10,000, $20,000 of fees that they can't get back. And so we're looking to kind of change that and move away from the lack of innovation that we're waiting for the government to pay for something. As you know, it takes a long, long time, to getting the public markets and the public system to kind of change that. And that's what we're doing here.
Now, is there a gold standard somewhere else that Canada could, or that you are looking up to?
Not necessarily where we're looking up to, but I think we know where we want to go.
Where's that?
And we wanted to change it completely to, like I said, a patient downloading an app, and in that app you have your chart that you have access to, your medications, and you know everything about yourself. You have the ability to plug in the healthcare monitoring devices that the last guys were talking about.
We were just discussing that as the biggest challenge, monitoring your own health.
The portability of your healthcare and the chart, and being part of that healthcare team as well, you being a patient. And then the ability to see your doctor or one of our doctors through telemedicine from the convenience of your home. So no more taking a day off of work to go to your doctor to get a prescription refill or to get your lab results, discussed about your cholesterol and so on. These are all things that are it's a waste of your time. It's a waste of the doctor's time to call you all the way in there. And it's a very inefficient use of even the access to the doctors that we have right now. So right now, we always talk about a lack of doctors, a shortage of doctors, let's say. There is a shortage of doctors in some locations. There's too many doctors in some other places. And it's because doctors are humans as well. They don't want to commute, an hour and a half, 2 hours to their clinic. They don't want to work. Nowadays, they don't want to work, 8 hours or even 6 hours sometimes. They don't want contracts. And they want to work on their time and have a lifestyle. And that is the future. So what we're doing is saying you can do that as a doctor as well. So as a doctor, you can work anywhere in the world. So for us, we're gladly accepting doctors coming on board, seeing these patients, and the doctor can be anywhere. They can be in Hawaii, they can be in Ontario, and connecting with these patients and helping them out without the need to have infrastructure, overhead, and commuting, and you're drawing now from a much bigger pool of doctors than the brick and mortar, let's say.
Right, and that's really, it sounds like the health tech or just healthcare industry catching up with the on-demand economy, right?
Absolutely.
I want things and I want them now. And I know that I would be far more on top of my health and performance if I didn't have to wait a week for my naturopath, a week for my physician, and then a week for the lab appointment, and then a week for the results.
Right.
And we're all busy. You know, how many appointments have I canceled or just not made because I'm looking a week forward into my calendar and can't make it happen.
And how much does it cost the system? I mean, how much does it cost the system for you to run out of your blood pressure pill and either go to Emerge, which costs a lot to get a prescription refill, or run out and you get a stroke, or run out of your diabetic medications and get complications? Right. Like, how much does that cost the system versus something like this, which is very easy to do, and using the public format, being able to apply it right away, which is great.
And are you the founder of Premier Health?
No, Premier Health was a public company. I came on as CEO about a month after they acquired the clinics. We bought the technology company just earlier this year, and then we bought 2 pharmacies as well in the Lower Mainland that is going to be part of our team. We believe in team-based medicine. So part of it is the family doctor and the doctors. Part of it is going to be the pharmacists. Part of it is going to be the mental health workers as well, so the counselors and psychiatrists, the specialists, the nutritionists, the naturopaths. They're all going to be plugging into you. So you, with your app, is going to follow you. It's going to have a portable chart, and they're all going to be plugging in through telemedicine, video conferencing to you, and you have continuity of care now with your chart. Something that is not sitting on your doctor's chart, you know, in his office, that you have no access to.
And since taking over leadership of this company, thinking back, what's been your biggest win, that milestone that you're most proud of?
I think bringing the team. We believe in expertise in each field, and so we're very happy with the medical side that we got. We're very happy with the acquisition of Cloud Practice out of Victoria. They're a great team. We expanded them. We expanded their space, and they're the ones that have been working on developing this portal, this patient portal app that you can download and plugs into those 3 million patient charts that we have in our system now. And then we believe in the acquisition of the pharmacies for the same reason. You know, it's not going to be, we're not going to be buying a lot of clinics or a lot of tech companies or a lot of pharmacies, but we will be partnering with a lot of clinics and a lot of pharmacies and a lot of different places around the world, around Canada, to plug into the same system.
Got it. And on the flip side, what's been the hardest part? What's your biggest challenge right now?
Tech development is always interesting. You know, they go at their pace. So sometimes that's a little bit frustrating because you want everything. You know where you want to go, but they have a job to do and they want to make sure that they do it right. So that kind of balance between pushing something where you want it, but you also don't want to push them too hard.
Yeah, right. Okay. Now, can you describe Premier Health in 2020, 2021 for us? What's happening?
So our first goal was to build that infrastructure. We did it, the platform. We just launched the app to our 3 million patients just recently, a few weeks ago. But we're also going to go direct to consumer. So one of the things that we're going to be doing is launching a brand of direct to patient telemedicine on demand as well. So outside of the ones that are already in our database, we want to focus on anybody in Canada being able to download the app, using it from their home or from their work, and getting the full care that they deserve, but also being part of their healthcare. So having that continuity of care and having that chart follow them no matter who they see. If they see another doctor, if they see a specialist, they see a counselor, having the ability to securely share that data with them at any time.
Got it. Is your team's here in Vancouver?
We are in Vancouver. Our tech team is out in Victoria, and our other subsidiaries are around the Lower Mainland right now, but we are expanding across country.
And are you seeing a new flood of capital? Because it's no coincidence that we're doing a big feature on the future of health at this show. Yeah. It's not always health. You know, in 2017, it was more or less a blockchain conference. Last year was different. What's inspiring this flood of capital moving towards the health tech sector? Necessity.
The healthcare industry can't continue the way it is. Like, we can't support the aging population with the inefficient use of resources right now. And so around the world, everybody understands this and they're all moving towards it. And if you just kind of get an idea right now, how many people here, used telemedicine to see their doctor in the last year? Probably next to nobody. So less than 1% is delivered through virtual care right now in Canada. I can see in the next 10 years that 30 to 50% or more will be some form of virtual care delivery because it's much more efficient. So it's not going to deal with everything. You still need doctors. You still need your doctor you're going to see.
And that was my next question. Yeah. Once we've consolidated all the data in the app, at what point do the algorithms become sophisticated enough to take the human element out of the diagnosis and the prescription?
So we see it a different way. So we use artificial intelligence right now to bring on the patient. So for me as a doctor in a clinic, I would love to have a nurse go in and see you first, take the history, get all that information in for you. But it's very expensive to have a medical office assistant and a nurse to see you before you go in, and then the government gives us, next to nothing in terms of that visit. It's very hard. So what happens is you go see your doctor, they rush through the history, and then they spend really, quick time giving you a prescription and you're out the door. So we're using technology to onboard the patient. So that artificial intelligence algorithm asking you questions the same way I would or my nurse would. So for instance, if you have a headache and you want to see a doctor, it'll ask you, do you have a headache? How bad is it from 1 to 10? Do you have it on the right side, left side, nausea, vomiting, fever, chills? Same kind of questions I would. Then it takes that information and gives it to the doctor. So your doctor now, before they see you, will have the history taken for them. They'll have the differential diagnosis. Now the technology is about anywhere between 90 and 96% accuracy for the differential diagnosis or so. And it has the treatment options and even the lab tests that you maybe should run as well. So before they even said hi to you, they have probably 10, 15 minutes of work done for them. And how efficient is that? How much more can they help you with now and spend time actually helping you and seeing more patients as well during the day if they had all that prep work, all that stuff that they don't need to do done for them?
Yeah, 100%.
Yeah.
Okay. Look, I love the product. I want it. Thank you so much for coming to speak with me today.
Thank you.
And I hope you guys enjoyed it.
Thank you.